Hi, welcome back to the last lecture on this unit for bones of head neck anatomy. So I believe I'm showing you the objectives, pages 5 and 6 for this unit, and we're on the last section of this for openings and passageways through bone. Most of this is review. Most of this we've already gone over. I'm just sort of pooling it together in a separate area in the objective sheet. And some of this is new, and we'll go over it. So keep that in mind, that most of this we've already seen. So let's go to the first slide. This material is important because we will be passing nerves through it, and I've put a number of the nerves in this section as an introduction to kind of get you started on associating cranial nerves to bony passages. So next slide. We've already talked about the superior orbital fissure, the SOF. You should be able to identify it and know that it's a feature of the sphenoid bone, sort of between the lesser wing and the greater wings, and that several nerves pass through it. So pretty soon you should be able to rattle off those 4 cranial nerves that pass through the SOF. It's 3, 4, 5, 1, and 6. They're right in order. And I've put the name in here. I'm not asking you to memorize names yet, but you will have to, so might as well just start at least looking at them. So those are the 4 cranial nerves that pass through the SOF, and that's review. Next slide. The inferior orbital fissure we mentioned was a passage. The inferior orbital fissure communicates with the infratemporal fossa and the pterygopalatine fossa. So in this figure, the yellow box is showing the location of the pterygopalatine fossa, which we've already gone over. I'm putting it in dashed yellow. And the point is that the IOF is sort of over here. And if you pass through the IOF, you can go back and forth between the orbit and the pterygopalatine fossa. Okay, so that's an important passageway. IOF communicating with the pterygopalatine fossa. Okay, next slide. These 3 foramina in a row, all part of the sphenoid bone. And we have the Foramen Rotundum. And through the Foramen Rotundum goes V2, the maxillary branch of the trigeminal nerve. So the trigeminal tri means 3, and the second branch goes through the Foramen Rotundum. Where does the first branch of the trigeminal nerve go? Right, through the SOF, through the superior orbital fissure. Okay, then we have the foramen ovale, and through that is the third and the largest branch of the trigeminal nerve, the mandibular branch of the trigeminal. For right now, if you want V2, V3 is good enough. But again, might as well start learning the names. And then the last foramen is the Foramen Spinosum, through which the middle meningeal artery passes. Okay. So, and then I have a note here for you to go back and review some of this material. Next slide. Just showing different passageways again. The inferior orbital fissure and the Foramen Valley, Foramen Spinosum. While I have this figure here, let me I might be thinking of another figure. Okay, let me back up one slide. There's not much, there's nothing new in this slide that we haven't already discussed. So let me back up a slide to this one. And what I should do, since I kind of realize I don't have any other good slides, like sort of an omission on my part, this slide shows the jugular foramen, both sides. So these are the jugular foramina, and sort of a jagged, convoluted opening. But this is how, basically, where they appear. They're hard to appreciate, but those are the jugular foramina. So I'm going to write that in. Jugular foramina. And this is passage for several cranial nerves. CNs, I'm abbreviating for cranial nerves. And the internal jugular vein. Okay. So we'll come back to arteries and veins later in the course. But for right now, appreciate that this is the internal jugular vein, not the external. Okay, so these are the jugular foramina. Get yourself oriented here while we have this view. There are quite a few things that you should be able to identify in this illustration. You should be able to identify the crista galli, the cribriform plate, and the olfactory foramina of the ethmoid bone. You should be able to recognize that. You should be able to recognize the hypophyseal fossa, HF, hypophyseal fossa of the sella turcica. And what bone is this? So you've identified these three foramina, the spinosum, ovale, and rotundum. Here is this ridge line. We're looking sort of straight down on the ridge of, what bone is that? This would be the temporal bone, and that's the petrous portion, or the petrous ridge. And then what is this opening? and what passes through it. Okay, we'll probably review that before we're done with this lecture. Next slide. So there is probably the only slide that I thought to include the jugular foramina. Notice its location relative to this petrous portion of the temporal bone and these three foramina that we've gone through. We have not yet talked about this opening, which we will shortly. This is the Foramen Lacerum, but we'll come back to that. Okay, next slide, which we already did. You should probably practice with identifying as much as you can on something like this. As far as what's on your objective sheet, so for example, you should be able to identify that horn, name the feature and the bone. You should be able to identify this feature being as specific as you can. There are two plates. This is a review, so I'm just going over some bony features of the pterygoid process again. So this is the lateral plate, and then you have a medial plate, and you have lateral and medial surfaces of both. Let's move on, otherwise we'll get bogged down. Next slide. Review of inferior skull features. So you should learn everything that's labeled in this figure. It's a little bit fuzzy, but I think it's readable. And I blanked out a few labels that I didn't want you to learn. But otherwise, you should go through this and review each of these labeled items because we have talked about them. Foramen Lacerum we will come to within this lecture. Okay, next slide. Here we go. Foramen Lacerum and the Carotid Canal. So we'll go back and read the notes in the objectives handout. But this is a passageway for the internal carotid artery. Not the external carotid, not the common carotid, but for the internal carotid artery. This is how it gets into the cranium and supplies blood to the brain tissue. It's the internal carotid, large artery. Well, it enters, it's coming up the neck along in the carotid canal, or the carotid groove, right along the sternocleidomastoid muscle in the neck. You can feel the carotid pulse, and the carotid artery divides, and the internal branch supplies the brain, and this is how it gets into the cranium. It ascends to the base of the skull, and then it enters through this external opening to the carotid canal. And the carotid canal runs through a part of the temporal bone, and I've outlined that in a little dashed red line. So that's a hidden canal, but the artery passes through that. And then after death and all soft tissue has been removed, you wind up with a foramen lacerum that is normally not present in life because it's filled with soft tissue, as the next slide will illustrate. So we're working on the carotid canal and the foramen lacerum. So you're looking at an inferior view of the skull, and this is the entrance for the internal carotid artery. Next slide. Get yourself oriented. Here is the internal carotid artery. So this is what's coming up from the neck, and it passes through this external opening. Oops. That's better. So this is what we were just looking at. So this is the external opening. To the carotid canal. And then we go into the carotid canal, which is shown here. And that's what I was drawing in the other illustration. And then we have another opening where the internal carotid exits, sort of the internal opening to the carotid canal. But let's not get too hung up on that. If you recognize the external opening to the carotid canal through which the internal carotid passes, and then the carotid canal, here is the Foramen Lacerum. And it is this tissue, or this space, that's filled with cartilage, soft tissue, in life. But after death, then that opens up, disappears, and now you have sort of an artificial foramen that passes through, and you can just stare inferiorly from the bottom of the skull straight into the cranium, because your eye, vision of your eye, I'll draw an eyeball down here. Here's an eye. Your eye can just peer right through there. And it appears like there's an opening in the bone. That's where the Foramen Lacerum would develop. Okay, next slide. Jugular Foramen. You should be able to find that on a picture of a skull that I've given you, several skull pictures that you should be able to do that with. And identify, tell me what goes through the jugular foramen. Well, we already went over the internal jugular vein, which is the largest of the veins. It's the internal jugular. And then 3 cranial nerves in order, 9, 10, and 11, pass through the jugular foramen. So we will go over those repeatedly as we get into the nervous system. But 9, 10, and 11. Next slide. Study the handout and the objectives and practice. Let's go back to, I believe that was the last slide. Yeah. So let's go back to the objectives that we have here. So on the left page, page 5, we've gone through the SOF, IOF, the different foramina. Let's see what we have here. The Foramen Lacerum, we just discussed, filled with cartilage in life. We talked about the Carotid Canal. Temporal Bone Foramina. Go back and review this. Oops, I can't write on it. Temporal Bone Foramina. Let's just let me scroll back. So let's go back to the temporal bone. And, okay, awkward page break. Temporal bone is, the features of it are shown on the left. 3 different portions, and then the 4 important openings. We have the internal acoustic meatus, we have the stylomastoid foramen, we have the petrotympanic fissure. You should be able to tell me that fairly soon what nerves pass through those openings. I know I'm pushing you quite a bit at the beginning, but it will make it easier when we get into the nerves if we don't have to go back and learn all these different openings at the same time. And then the hiatus to the pterygoid canal for passage of the greater petrosal nerve. Note, you do not need to identify it. So I didn't put it in as something to identify. I never do. It's difficult to see and difficult to appreciate. But I will ask you to know what nerve passes through that eventually. So that's pretty much it for this module in the course on bones. What we do after this is muscles, and then we do nerves, and then blood vessels, and a few odds and ends, and we're basically done with the course. So we have a couple of weeks to get this material down before we have an exam on that. And I'll be talking with you more about exam dates and scheduling, etc. So, it's a lot of material. Welcome to the course. You'll do it. You'll get through it. It just takes some time. So, if you have questions, I hope you get a hold of me. I look forward to talking with you all as we go through the course. Bye.